consultant for the Carolina Hurricanes. So our title of this is, kind of the arthritic knee. A lot of what I'm going to focus on in our talk is going to be patellofemoral base, patellofemoral joint pain, I think. So this is less about classic osteoarthritis, although I will touch on that. I'll touch on some different versions of arthritic thing we'll see in terms of cartilage, a little bit on cartilage repair and kind of osteochondral work. But the majority of our talk will summarize current research and kind of thought processes as it revolves around patellofemoral pain, different levels and progressions of that, how exercise will fit in. We'll talk about screening and assessment. How do we determine if there's relevant asymmetry, compensatory movement patterns, and how does that then lead us to design effective rehab and corrective exercise programs for people that want to maximize their function. A lot of people want to avoid surgery, and I'll probably talk about a couple simple case studies later of quote-unquote what seem to be routine patellofemoral or clean-out procedures that kind of morphs into more debilitating conditions. So sometimes, I like to tell patients there's no such thing as simple or routine surgery. So we'll kind of delve through different phases of the non-operative rehab. And then kind of touch on multimodal treatment approaches, how we treat these patients, different things that might work in different situations, and kind of being open to expanding your toolbox for them. And then for your active population, how do you know when it's okay to let them, let loose again? When can they rump? When can they jump? When can they get back into their training? I see a lot of very active people that are 35 to 55 that, when I think back to when I was 25 starting my PT world practice, 55-year-old people weren't going to boot camp classes and doing high intensity exercise, and today they are. So things have changed that way. So, a case in point, I saw a young lady this morning, first time, 39-year-old female, likes to do high impact work, plyometrics, running, jumping, rope. She does boot camp class several days a week, then goes and lifts heavy as well in the gym. And she had been able to do things relatively pain-free until about 4 to 5 months ago. Suddenly develops pretty significant left-sided patellofemoral, lateral-based patellofemoral pain, cannot pistol squat anymore to the depth that this young lady demonstrates on the left. Goes and sees the doc and basically is told, hey, let's cool your impact activity down. She takes 6 weeks off, really no better, goes back, gets an MRI. MRI reveals pretty significant patellofemoral arthritis, a grade 3 fissuring along the lateral facet, just